Oh, that's lucky. That's lucky, Bill. Okay. So yes, we're going to be uncovering the reasons why patients don't book in for their treatment, what they need to book in for their treatment, when to follow up, how to follow up, and the downloads and resources that we'll be supplying you and mentioning throughout this presentation. That and the recording of today will all be emailed through to you this afternoon. So first of all, let's go through all the reasons why people may not book in for their treatment in the first place. And confusion really is number one. Confused minds always say no. That's a common saying. And when we're talking to laymen about dental terminology and dental conditions and dental solutions, confusion can be pretty high up on the list. Now, when we are speaking with another human being, not in a dental setting, studies indicate they only really absorb 50% of what you say. But when we layer into that, they're in a dental surgery, there may be an element of anxiety. They may be thinking, how much is all this going to cost me? I've got to race off to my next appointment time. There could be a whole bunch of other reasons why, maybe even distractions. The room changeover is really noisy while it's all being communicated. So whatever reason is going on, you are likely, the things that you're saying to that patient, it is likely less than 50% that they're walking away with and being able to really truly understand. And so confusion is a big reason why dental patients don't book in for their advised treatment. The next reason is affordability. And let's face it, we're all talking about the higher cost of living nowadays. We understand that out of all the health services that we are required to spend money on in any kind of 5-year period, dentistry is probably going to be really, the top of the list for most of us, unless we need some specific care systematically for our body. So affordability, it is something that's going to cost hundreds to thousands of dollars to get done rather than tens to hundreds of dollars to get done. Anxiety is another one. It's how many people actually do suffer from some form of dental anxiety. Sometimes it's all the way to the end and it's quite a phobia, but other times it's just, I just don't want to go. And you and I recently went out to a dental practice locally and we're talking about reasons why people don't necessarily book in for their scale and cleans. And the person that we were speaking to works in a medical dental practice and said, I haven't booked in yet because I just don't find it comfortable enough. And so the anxiety can even just be, I don't want that service. And so that's the barrier to booking in.
Someone's just got their hand raised, Julie.
Beautiful.
So, Louise, you had a question. Did you want to type it in the chat or
Or
would
the Q, or the Q&A if the chat's not working.
or the Q&A? Yes.
Beautiful. While you're typing that in, and we do welcome you to interrupt as often as you like. It's good to be able to get your questions answered as they are pertinent in your mind. Another reason why people don't book in is time challenges. Maybe, I still remember back in my day, a late evening session went through to 9 o'clock. Early morning starts were 7 o'clock, but I find more and more practices are kind of restricting down those extended times now. And so a late evening is, you only go through to 7 o'clock of a nighttime sort of thing. So sometimes it's the time challenge of actually even getting in. Low priority is another reason why they kind of, can kind of be hinged into confusion a little bit. If they really understood the sense of urgency of getting their condition treated, they may put it as a higher priority. But some people do have dental health as a very high priority. The ones that come in every 6 months for their checkups and cleans, if they need anything done, it's a high priority thing. It's not 100% of your patient base though. So a lot of them may think to themselves, yeah, I need it, but I haven't been to the dentist for the last month and it really hasn't presented a huge problem for me. I'll look after it later on. The sixth reason is maybe they don't like your practice. Maybe they've got the money, they've got the time, they don't have any anxiety about it. They're totally clear on what needs to happen. They just don't want to come to you. And so they are going to definitely book in for that treatment, but they're going to be doing it elsewhere. They may not trust your opinion, and dentistry is certainly one of those areas where you can go to 6 different dentists and get 6 different results from your dental examination. And so sometimes people develop a bit of distrust for dentistry in general, or they may, for whatever reason, not trust your specific opinion. And it may be that you're not clear enough in the description. Maybe you seem a little bit nervous because you're a new grad or whatever the thing is, but they just don't trust your opinion. Maybe you've done treatment for them in the past, it's failed, and that's helped them distrust your opinion. And the eighth reason is there is just no urgency. Again, I've got the money, I've got everything, but I've got so many other things that are on the top of my list that there is no sense of urgency. The sense of urgency we're going to talk about more specifically in how to make sure patients do have that sense of the same sense of urgency that you guys have when you're discussing their treatment options with them. We want to have them walk away with that sense of urgency as well. So they're the reasons why people don't book in for treatment. I'm sure there are other reasons as well, but they're the primary 8 reasons why they won't book in with you. What do they need? And this is a very good list to have in your heads as a dental team, and even discuss it as a dental team, because these 5 things that a patient needs, we need to make sure that we're ticking the boxes, doing these things as effectively as we can in order to make sure that we're encouraging our patients to book in and not end up on that incomplete treatment list. Number 1, they need to have the diagnosis. So they need to have someone tell them this is what your current health issue is. Of course, that's number 1. What's actually going wrong? The second thing that they need is to understand that should no treatment be done in the natural course of time, what is that condition going to eventually look like? So if no intervention, what's going to happen? And that starts to build up that sense of urgency that I don't want, I know where I am right now, but future pacing down the track, I don't want to lose this tooth. So what I want, so all of a sudden I'm a bit more urgent now about what I need to get done. So they need to know their condition. They need to know what happens if they do nothing about it. And then that leads us to number 3. They need to know what the advised treatment solutions are. What's the treatment plan? What do you advise gets done? And what is involved in that? How many appointment times, the costs, all the things. The 4th is the advantages to the treatments. And this is a big one as well. Sometimes we can feel like that we're trying to con a patient into a yes by really effectively detailing the benefits and the positive outcomes the patient's going to achieve by going forward with treatment. However, they need to understand what their future looks like with that treatment to properly be able to make a decision for themselves, an informed decision for themselves. And so an example of this would be, you've got a cracked tooth with a really large filling. I suggest you have a crown done. And rather than just go a crown full stop, and this is how much it costs, and this is what the treatment appointment times look like, then say, and then with that tooth, that goes from being a weak tooth in your mouth to a very strong tooth in your mouth. The restoration is designed to last for a long, long time. And you've got peace of mind in that tooth rather than worrying about it anymore. And so talk to them about the benefits and the positive outcomes, because that's quite often where we base our decisions on as well. And the 5th thing that a patient needs to know in order to book in is the consequences of declining treatment. And we're going to build that element into some of our communications that you'll read about later on. And so they've always got the option of doing nothing, but what is then going to happen? One of the things we want to speak about, there's a couple of areas that we want you to be mindful of as we're moving through the rest of this webinar and getting into the actual incomplete treatment list itself. One of those things is the engagement process. Now, when I stood into that role, stepped into the role of patient coordinator, we called it facilitator in the practice that I was working at, it was the first time I was going into that facilitation role where I was going to be present for the dental examination. The dentist was going to make their recommendation and then leave me in the room with the patient so I could step through all of the other communications around that. And of course, I wanted to be good at what I did, and I really did enjoy that process. One of the books I purchased to be able to research it a little bit was a book called The Anatomy of Buying, I think, The Buying Anatomy, which was by Norbert Aubuchon. And in it, he talks about the buying process. And we'll just move very swiftly through it, just to give you an idea of where we often slip up in the patient engagement process in the surgery itself. Whenever we buy anything as consumers, we go through the same 5-step process when we buy. And that is, first of all, we identify a need, that we need to buy something. Then the second step is we recognize that need is strong enough for us to actually take action. Because, you know, as I say, we all need a holiday. How many of us have got the flights booked? The third thing is the search, that we would need to search for the solutions to address our need. And then we go through evaluation, where we're evaluating all the data we've collected. And then the fifth and final step is a decision. I'm going to go with this option, or I'm going to decide not to do anything at all because I can't afford any of them, or I don't want to do any of those options. Translating that into the surgery, we're going to call it the patient engagement process. So the very first step is the need. That is the dental examination, where you are identifying conditions in the mouth and things that need to be done. The second step is the step that quite often we do miss in the dental surgery situation, and that is recognition. We recognise that the need is strong enough for the patient to do something about. However, the patient isn't often put in that position. So it is about encouraging all of the team members, especially the practitioners in this step, to speak to the patient about the ramifications. If we weren't going to do anything, what does that condition end up looking like? What does it end up progressing like? And it's that information that helps patients identify, yes, I understand there's a need because the dentist is telling me so. However, because of then I now know what's going on in the dentist's mind, what they're seeing. I now know what the repercussions of doing nothing are. Now I'm also recognising that that need needs to have action taken upon it. And then we move through search, the different treatment options, all the costings, etc. Evaluation, sometimes they can evaluate with you in the spot. Yep, let's just book it in. Sometimes they need to go home and think about it, and then they get to that final decision. And so this recognition part of it is something that really does play a role into incomplete treatment management, because patients are on that incomplete treatment list for a reason. And if it's because of confusion, lack of urgency, lack of prioritization, it's the recognition step that is likely to have been missed. And so do keep that in mind. Put any questions up about that if you have any. The other thing we want to get your mind around as well is the people on your incomplete treatment list. How many of them are likely to book in? How many of them are unlikely to book in? So we need to just quickly move through the 3 categories of patients that we've identified. And all of your practices have a percentage of each of these categories. Number 1 is the transients. And these are the ones that just come in for urgent care. They don't come for checkups and cleans. If you said to them, I've seen a number of things going on in your mouth, I really do encourage you to come back for a checkup after we get this tooth extracted. They are unlikely to book in for that appointment time. They really come for urgent care only. They've come to you because you can see them. The next time they have urgent care needs, they will call you. If you can't see them at the time they want to be seen, no skin off their nose, they'll just go somewhere else. So they're the transients, very important group. You know, we see everyone. We want to make sure that everyone understands we see everybody, but that's one of the categories within our patient base. Then we have the loyals. The loyals are the ones that will only ever see you. They don't want to go anywhere else. They'll wait a day to get something urgent seen to just to make sure they keep coming back to your practice. They don't generally come in for 6 monthly checkups and cleans, probably not even yearly. They may come in every now and again for a checkup and clean because it's been a few years by now and I need to get that done. But they'll certainly, if you say to them, come back in, I've seen another cavity, they'll come in. Come back in, I've seen a huge filling that's got a crack line back to break open, then they'll come back in. But they're are just like the loyals, but they're the ones that come in every 6 months for their checkups and cleans. So when we're thinking about who's actually appearing on our incomplete treatment list, The range of services that are housed within those patients, and then the type of patient we are talking about or focusing on, will give us an indication of how much follow-up to actually go through. And so the people that will be appearing in your list, they will either have discretionary non-urgent treatments in that treatment list: aesthetics, orthodontics, preventive. They are less likely to respond because there's no sense of urgency about that. And there's often no repercussion that's really compelling if they don't go ahead with treatment. And so understandably, they are less likely to respond. The next step up is corrective. So it's semi-urgent. They're not going through any urgent pain or breakdown at the moment, but maybe there's a restoration they need, maybe tooth replacement, maybe disease control in terms of periodontal care. And they are more likely to respond because this is where you do have repercussions if you don't get things treated. The decay is only going to get bigger. The missing tooth will only have more collapse into that space. Your periodontal disease will just get worse. And so this is where the sense of urgency is very important, because this is where people are more likely to respond. They get the sense of urgency by having that repercussion detailed to them of not getting any treatment done. That's when they can make a decision that need and recognize that need of treatment is something that they want to take action on. And then we've got the highest level, disease management, urgent. This is where we've got active decay, active infection, active trauma, and this is where they, again, are much more likely to book in. If we go back to the previous slide, sending a transient patient 5 communications to book in for their incomplete treatment will be a waste of time and energy and just annoy everybody involved. However, you will get from your loyals and perpetual patients, and you can see by their history, then the clinical notes in their history, if they are a loyal, perpetual, or a transient indeed. But with the loyal and perpetuals, these are ones that you look at and you say the transient, you need to tell them about it, remind them about it, because that's duty of care. But you wouldn't continue on harping on about it. But with the loyals and perpetuals, we want to get into their mindset and think, what do we need to do for them in order to encourage them to book in? And so that's when you come back to this, what the patient needs in order to book in. Have we effectively moved through each of those steps? The most effective time to book a patient in is at the time that you're discussing that treatment recommendation with them. They're in your surgery, so dentistry is of high priority to them in the moment. They understand everything to the best that they can while you're explaining it to them, and they can ask questions to clarify and to make sure they do understand things. So the sweet spot is really when they're in the surgery. The minute they leave the surgery, and days, weeks, months go by, and their level of engagement really starts to drop away. And so it is very difficult to, a month down the track, to send a letter or an SMS or a phone message to a patient and say, you had some treatment that needed to be done, call us and book in for an appointment time. It's very difficult to get them back to that sweet spot, if it's possible at all, in that kind of communication. So often the best thing to do is, because we've obviously missed something, there's a reason why that patient hasn't booked in. If it's not just a transient, if they actually do care about their oral health, there's something that we're missing there. And it takes a lot of explanation, a lot of re-engagement to be able to get them to the point of booking in when they haven't already booked in before, even though they have known the information in the past. And so just get them back in for anything. So that communication, if you can only do one simple communication, it's often good to say, come back in for a short, no charge appointment time, 15 minutes, so we can re-clarify that the situation is still one that we need to take action on, answer any questions you have about your treatment plan, provide you all the information you need about our payment plans, etc. And then we can go ahead and book you in for the actual treatment. So it's all about getting them back in for anything to re-engage, identify obstacles, and rebuild that sense of urgency that you've got in your mind. That's why you're contacting them again, and rebuild that urgency up in their mind as well. And so it could be just a 15-minute no-charge consultation. If they've had some previous treatment, you can, extraction, for example, that's then building up that they need to have an implant next. You could then say, let's come bring you back in, make sure that the extraction site's healing beautifully. We just gave you a grinding splint. Bring that back in, make sure it's all fitting well, and you've got no questions about that. So bring them back for anything, just to be able to re-engage them again. When we are trying to effectively communicate with another human being, any communication course will let you know, look them in the eye, that there are certain communication and rapport building techniques, speak nice and strongly and slowly enough that people can hear you, listen effectively, all the things. We've got all these communication styles that if we don't pay attention to them, our ability to effectively communicate can be hampered. And when we're communicating with patients in terms of trying to re-engage them back for a recall strategy or incomplete treatment, or for next week's topic, the inactive patient base, trying to bring them back in again, we have to think about our communication style. And so we've got at our disposal phone calls, SMSs, emails, letters, and social messaging at our disposal in order to communicate with our patients. Each one of these have benefits and drawbacks to them. And for example, phone calls in the past have been wildly excellent. Most of the time, people answered their phones because they were either at work or at home. And when they do answer, it's very engaging. You get to speak one-on-one with them, feedback to and fro, identifying barriers, all answering questions, all the things. But more and more now, people are not answering their phones. And so then you're just left with leaving a voice message, which can be wildly ineffective. And a lot of people nowadays don't even listen to their voice messages. And there's a story that Medi and I like to say. There was somebody that was called they called their patient to book an appointment time or confirm an appointment time or something. And the young person's voice message said, "Why are you listening to this message and leaving me a message? Why don't you just text me?" And so we have to kind of go with the flow. Who are we speaking to? Is a phone call going to be effective for someone who is 50, 60, 70 years old? Hell yes. What about for somebody who is 20, 30 years? No way. They don't want to speak to you on the phone. And so do think about the mode of communication that you are going to be using. How effective in terms of engagement are they with their open rates and impression rates, and use the thing that makes most sense. When we're talking about providing patients with some of the communications that we've got coming up in future slides, then all of a sudden letter and email starts making a whole lot better sense than phone calls. Certainly is not social messaging. That's a really poor way generally across the board. Only a very young demographic really just prefer using social messaging. However, emails, unless someone's expecting an email, very low open rate. Letters, hugely high open rate, just a little bit more costly. You've got to stamp and an envelope and all the energy to print off the letter as well. So there are ways that you can use each of these modes of communication effectively. For incomplete treatment, patient management, communications, one of the best things you can do is phone call. If you can get them on the phone, that's a great thing. And also send them through an email or letter. That's a great thing. But really do use the SMS in a way that is preparing them for a communication. So Amina, I've just sent you an email. Can you go straight there and have a look at it? It's important. It's about your incomplete treatment. If you sent Amina a letter, she'll be opening it anyway. So that's all good. But if I was going to phone Amina and she's of a younger age group, I might say, I'd like to have a chat with you about something I've noticed on your incomplete treatment file, Amina, and you put this as an SMS. What's the best time to call you? Or call me when you're next free. And so SMSs can be quite transient. When they start kind of going down below the line, you just forget that it's even there. They need to be very short and concise as well, but that can be a wonderful way of prepping someone to then build a little bit more engagement in your level of communication. So do have a look. What's our patient type? Who are we speaking to? What's going to be how much information are we going to be delivering to them? What's the most effective way of reaching out to them? We're going to tell you the messaging to put in your communication styles, but we wanted to give you the process. What is an effective process in terms of attracting back a patient who has incomplete treatment? And we do suggest 3 steps. We want to have enough steps enough, contact them enough times where we are going to be increasing the chances of them booking in. But we don't want to tip over and become harassing. We don't want our patients to find it difficult to work with us, to be with us, to be one of our patients. And so Carol and Dean, from a recall perspective, delivered figures that once you hit somebody once to come back in for their recall, you get a fair chunk of people responding positively. But when you go to a third time, all of a sudden that number jumps big time. And so we're going to use that same methodology in the incomplete treatment process as well. We're going to go with 3. Any more than 3 we think would then be harassing. And so the things you need to remember are, what is the mode of communication that we're going to use the very first time we reach out? And what's the message that we're delivering? And then what's the time interval before we then send the next communication out? What's that mode of communication? What's that message? Then we're going to leave it again, and then we're going to go through a third step as well. Once we've reached that third step, we then default that patient into the recall strategy that we then, because quite often by then it's going to be weeks or possibly months down the track by the time we hit that third step. And so then a lot of dentists would then say, well, I really need to see that patient again because it's been enough time that's gone by. Things may have changed. New things may have happened that now I wouldn't be happy just going full on into that treatment plan that we developed months ago. So then to bring them back in for that checkup and clean again, and reassessing, re-diagnosing is a very effective step. We also think that, and we said before we started recording, that having a long list of patients who have incomplete treatment and starting with number 1 of 50 or number 1 of 100 and moving through that list is one of the most demotivating things for the team member themselves. And even though the top 5, 10 calls you're making or letters you're typing up, you've got a great energy about you. I feel like I'm looking after the patient. We'll bring them back in, get them all sorted. They'll be happy. It'll all be good. The book will be filler, all the things. It's going to be great. But then when you're making the 12th call, the 13th call, the 14th call, you're constantly leaving messages feeling ineffective. You're researching again for this letter, what do I write in for this letter? It becomes a laborious process, and your level of enthusiasm as the person doing it starts to take a dive. We want to avoid that. That's not going to result in the best results. So what is a much more effective path to take is for your receptionist to either use the miscellaneous column in the calendar, in this dental software calendar schedule. Not always ideal, because you can end up with a number of messages there that are only relevant to the receptionist. And so what we don't want to create is an environment where all the team members think to themselves, they do a very quick scan of the miscellaneous column and go, none of that really ever applies to me, so I'm not going to read it anymore. But you could use that, or have the receptionists have their own online, Outlook or Google Calendar. Wonderful way of keeping track of all sorts of tasks as a receptionist. So it's got so many different benefits to it. But for this particular topic, it's terrific, because as the patient leaves the surgery without booking an appointment time, at that moment, that receptionist has all the information they need to be able to customize the next contact to that patient, the next communication. Given that this patient, I think, is pretty transient, wasn't really interested in booking in, is my next communication going to be to telephone them? Probably not, because they're going to be just as disengaged in the process then. So you might think, no, actually, I think this person will need to have a letter so they can have it sitting in their pile of letters, and one day they may address it. So I think this person would need to have a letter sent out to them. So I'm going to put in my online calendar, maybe in 2 weeks' time, so they don't forget about us, send letter to Barry Smith regarding the 2 fillings that he needs to have done. However, if it's a perpetual patient in front of you and the only reason they weren't booking in was because they needed their work schedule, they don't have it yet, they're getting it in a couple of days' time, then that one would be just a phone call. So the receptionist can then go in 3 days' time. If I don't hear back from Barry Smith, ring to book in for those 2 fillings. Just needed to have his roster to book in. He'll have it by now. And so that kind of diarising works beautifully well because, number one, that's how you avoid the big monthly task that you slowly grind through for the whole month and then usually don't get through the whole thing. So the next month is going to be even bigger. You are managing the number of communications you need to manage every day. And so you're not going to put 20 in there. You've got to put in 2, 3 every day and have that high level of energy for each of those. And it's done and dusted. It's not a task you don't like anymore. It's an enjoyable task now. It allows you to customize those communications and the messaging more effectively. And you've got more considered communications as well. So if there's anything else that you think that would be helpful, that you can let yourself know about, you've got all of that information right there. So all of your communications with that particular patient are far more considered. For example, Amina, we spoke about you just needing your roster. And I think you're going to get that over the last couple of days. Do you have that now? Did you want to go right ahead and book in? I know that you normally like Friday mornings. Is that right? And so the diarising of the patient follow-ups takes this management of the incomplete treatment list to one huge, often badly managed task to something that is enjoyable and far more effective.
And I think that's exactly it. The effectiveness. I think sometimes it may not be yourself that is undertaking the task. Maybe you're the one that manages it in terms of you ask for this to be done or you give some type of instruction. And we think that the objective is pretty obvious, but sometimes it's not. And I find these tasks can become very much, people can become very much task orientated rather than outcomes orientated. And they just get focused on getting through this goddamn list rather than, I'm better off just contacting 5 or 10 people, but actually getting them to commit to coming back to the practice. Rather than getting through 50 today, 50 like just crossing off my piece of paper, but none actually coming in.
Yeah, that's right. That's right. I've got a line through the name, so job done, rather than I've got a patient in the book, or an effective communication, therefore job done. So we've got 3 versions of an outstanding treatment letter that you are more than free to use verbatim or modify the wording to suit you guys. We've also got a far more simple phone call strategy that you can use as well. But when we are talking about diarising our follow-ups and customising them, and we've only got 2 or 3 a day, all of a sudden the letter situation is far more doable. And you can email this letter, you can send this letter. Sending is always better. If you're going to email it, always premise it with an SMS. We've just emailed you something important, have a look. And we're going to share the wording with you of each of these 3 letters. And what we are trying to address with each of these 3 letters is getting them back to understanding ramifications and getting them back to that space where they're making that recognition that the need that you've identified for them is something they want to take action on. So we'll just read through these quickly. How much time do we have? Oh, no, we're going pretty well with time. That's all good. That's all good. So I'll just share the screen again. Letter number 1, this is one where you could just have, because keep in mind with all these letters, you can have them within your dental software, templated within your dental software, but you can also use something like Text Expander. If you were emailing or writing a letter either, you can have all this under, like with just by putting a character, like an exclamation point and letter 1, all of a sudden these letters will just be populated very, very quickly. And we've got a training video presentation on Text Expander. And so we'll add that to what we send out to you because it can certainly help make your life a whole lot quicker and these tasks less complicated to do. Therefore, they're going to get done really effectively. And so this first letter, let me just make it a wee bit bigger. We've been thinking about you lately, and since a bit of time has elapsed since we last spoke, we wanted to remind you that there was some treatment recommended that has not yet been completed. If you would like to be reminded of the details of the discussions we had, please contact the practice and we'll provide a summary and price estimation. Amina, we certainly want to offer you the right help at the right time. From the clinical perspective, that time is now, as no problem or the conditions that cause them get better on their own. There are times when personal issues make it difficult for you to choose this care for yourself right now. If that is the case, we welcome the opportunity to discuss this with you so we can suggest an interim approach that will hold you in a stable condition until you can opt for the more long-lasting and durable solutions. I have asked Julie to give you a call in a few days to follow up and learn what you are thinking at this point. You can either organise an appointment time to take the next step in your treatment or arrange for a consultation for us to hold further discussions and answer any queries that you might have. Best regards. And that must be from the dentist. This is an important aspect of it. It must be from the dentist. You need to say, receptionist Julie is going to give you a call in a few days. So they're expecting that phone call then. And we're giving them an out. It's not, are you going to book in or not? We're saying, if you can't book in right now, let us talk to you about an interim approach that will hold you in a stable condition. And so transients will likely ignore this letter, but the loyals and the perpetuals won't likely ignore this letter. They don't want the repercussions that were discussed with them. Hopefully they still remember, but they do, with this line of nothing gets better by itself on their own, that starts to build that sense of urgency up as well, because they think it's constantly getting worse, which most things actually are. The second incomplete treatment letter is one that has two options. And so you can choose which letter to send. If you've got a number that you want to send out, send the first letter. Get a whole bunch, send it out. If you want to customize it, if it's a little bit more information that you want to share with the patient, then go with either the letter that gives two options or the letter that gives three options. And the difference between them is if there is a filling that needs to be done because there's a decay, there's really only two options. You do the filling or you don't. However, if it is implant that the patient want, if it's filling a missing tooth area, then they may have the option of implant or bridge or denture or do nothing. And so it depends on what treatment's in their treatment plan, and you'll be easily then able to identify, is this a 2-option job or a 3-option job? So again, you can have all these letters templated within your dental software. Same sort of thing. Dear Amina, we have been thinking about you lately. And again, from the dentist, it's the dentist speaking to the patient. And since some time has elapsed since we last spoke, we wanted to give you a written review of what is pending. You may remember that we had some recommendations when we saw you last. At the time, we discovered the condition. I suggested, and so you write down what the condition is, and I suggested the following treatments for you. If it was the condition was a decayed tooth, the treatment, a composite filling for that tooth, the benefits. Now, this is the thing with these letters, these option 2 and option 3 letters, the benefits and the drawbacks for whatever treatment that you've suggested are usually the same. So even that can be templated. It takes out that complexity. Remember, a lot of people do either move towards a benefit or away from a drawback. So we need to list these here. The benefit of the filling is predictable long-term comfort and functionality. It's aesthetically pleasing, and it gives you high peace of mind. The drawback is that there's an out-of-pocket fee for the service. The price is this. My advice, again, you can advise your patient what to do. It's not pushing them. It's not pressuring them. Quite often, we go to professionals to get their advice. You can deliver advice. What do you think of this wording? This option offers a good outcome in terms of function, aesthetics, and comfort. it is my advice to opt for this option, as it will resolve your condition. That's perfectly legitimate advice. You've also got a second option, to do nothing. The benefit to doing nothing is no financial outlay. And another benefit is no further appointment times for this condition. The drawbacks are further breakdown will occur. Resolutions will become more complex and expensive with additional breakdown. Possibility of future pain is another drawback, and low peace of mind is another potential drawback. The price is nothing, nil. My advice: I do appreciate the challenges many patients face when deciding what treatments are best for them. I understand that at times these challenges can make the option of doing nothing appealing. However, the drawbacks of choosing this option for your particular condition lead me to advise against it. Nice and easy. And then we move through. We certainly want to offer you the right help at the right time. From a clinical perspective, that time is now, is no problem. All conditions that cause them get better on their own, just like that first letter. Again, I've asked Julie to give you a call in a few days to learn what you are thinking at this time. The 3-option letter is as follows. A lot of it's the same as the 2-option letter. Option 1 is to get a dental implant, for example. The benefits: long-term solution, predictable long-term comfort and functionality. It's aesthetically pleasing and you have high peace of mind. The drawbacks: higher financial outlay. Several visits are required. The price is this. My advice: this option is the one that offers you the best outcomes in terms of function, aesthetics, and comfort. It is my advice that this is the best option to resolve your condition. The second option is the interim one. So the second option is to get a part denture, and for example, and just have that tooth replaced with a denture. The benefits are it's an effective short-term solution. You've got short-term predictable comfort and functionality. It is a lower financial outlay. That's another benefit. And you do not lose the chance to adopt option 1 in the future. That's one of the benefits. So if they can't see themselves getting to option 1 straight away, you're giving them an interim step to take to make sure they're doing something to contribute towards their oral health. The drawbacks: risk of breakdown and additional treatment in the future. And you have a reduced peace of mind because it's not a full permanent solution there. This is the price. And my advice: even though this is not a complete resolution, option 2 will address the immediate concerns of your condition. If you deem option 1 as unattainable, then I advise you commence with this option in the near future. And then we move through option 3, do nothing. It's no financial outlay, no appointment times. The drawbacks, again: further breakdown will occur, resolutions become more complex and expensive, possibility of future pain, low peace of mind. The price is nothing. And again, I do appreciate challenges many patients face when deciding what treatments are best for them. However, I understand that at times these challenges can make the option of doing nothing appealing. However, the drawbacks of choosing this option for your particular condition lead me to advise against it. And the same as the previous 2 letters. Time is to act is now, and I've asked Julie to give you a call. So those letters we're going to provide to you as downloads so you can copy, paste, modify the text. Once they are templated into your dental software, or once you've decided to use Text Expander, which is a wonderful tool to use, you'll be far more effective in your communications given that level of detail. And it's a step that quite often we don't take because we don't think it's easy to template. But I think that once you can chat with the rest of the practitioners in your group, you will certainly be able to come up with wording, if you don't like that wording, that's going to really help you and your practice. Now, the follow-up call that you give to patients after that letter. So the receptionist has sent the letter, and now the next diary entry is, I'm going to call this person in a week, couple of days, not too long away. We want them to have received that communication and within a day or two get that telephone call. So maybe a week after when you're sending it in the mail, give Australia Post a chance to get it out to them. And then all you have to say as the receptionist is, "Hi, Amina, I hope I've called you at a convenient time. Dr. Dentist asked me to contact you to follow up on the letter he sent you last week. Have you had a chance to read it? Dr. Dentist suggested that what we do at your next visit is actually up to you. We can schedule an appointment time to start the treatment plan option that you have decided upon, or we can book a no-charge consult and discuss how we can best manage your dental situation. What are your thoughts, Amina? What would you like to do?" And so that telephone communication is providing a very clear and easy next step for that patient. They've either made a decision to move forward with the treatment or they need greater clarification. And you can even, if they don't want to book in for anything at all, ask them, "Amina, is there any information that you are needing that I can provide to you that will help you make a decision more clearly about that, or help you manage that oral condition more effectively?" Because we want to get very comfortable with these sort of communications, because sometimes we just want to get the stuff out of our mouth rather than really listening and prompting that patient to be giving us feedback of where the knowledge gap is, where the engagement gap is. And so this is certainly one of those tasks as a dental receptionist. Start with one phone call, 2, 3, 4, you'll get better over time. Meaning, how often do we feel completely incompetent at the start of these sort of communications? Because they're sometimes a little bit outside of what we normally do. But the more we do them, the more effective we get. And it's quick if we get that repetition up and happening straight away.
Yeah, it's just a practice thing. And I think too, if you're new to it and there is someone in the practice that's a real superstar at this, but maybe it's not going to be their job anymore, just sitting with that person and listening to them make a few of these calls can be really, really helpful. Exposing yourself to, practicing as much as possible. Just get in there and do it. Give it a go. And don't try and do too many at once. We do the first 5 and we sound motivated and lovely and friendly, and then we get to 6, 7, 8 and it's like, So break them up into bite-sized chunks to get through them, because, it can be difficult to stay motivated. What used to excite me, however, was if I could get a good turnaround or acceptance on the calls, then that kind of keeps you going, keeps you motivated.
It does. It does.
Do people actually listen to you, Julie?
Only when I make them or pay them. Now, this is just another version, a downloadable one that we'll be sending out to you, that you can have this as a little sheet or a laminated sheet sitting at the front desk. That, again, is just a bit of a scripted guide of when someone is doing these sort of phone calls. You haven't sent all the letters. This is just if you've told a team member, start reading incomplete treatment patients. This is possibly a good script to use. "Hi, Amina, it's Julie from Your Magnificent Dentist. How are you? Dr. Dentist wanted me to give you a call regarding the filling that we needed to get done on your lower right molar. Do you remember him speaking to you about this? Yes. What to say? No. All the rest." So you can sit there and you can move through the responses and have a bit of verbiage there as well. So do download that if you think that would be helpful. Now, if you haven't looked after the incomplete treatment list for a long time and you've got a long list of people there, what do you got to do with them? And what we do say is, if they are beyond 6 months, 5 months old, then bring them back straight into the recall system. It's too long since that last diagnosis. Anything could have happened in their mouth since then. By that stage, a lot's happened in their life. They're completely disengaged from the information that you delivered them all that time ago. And so bring them back into the recall system, wait for their next checkup, re-diagnose, and then activate your new treatment incomplete strategy. We do want to give you some tips for great success. Number 1, make it super easy for them to book in the moment, in the second they think, yeah, I should really book in. So whether they're reading your SMS, your email, your letter at 10 o'clock in the morning, 10 o'clock at night. We want to have them be able to book that next appointment time in. So if you do have online booking availability, make sure you include the booking link in your communication, make it obvious, or go to the website and book in, and have it all very easy to do. We want to take as many barriers out as possible. It's actually a good theme to have. Be as easy as possible for your patients to deal with you, and that's one of the ways you can do it. The second thing is discuss payment plan options with a link to the website page. Payment plans can make an enormous difference in your treatment plan conversion rate. And we sometimes think, oh, we've got the payment plan, we've got Easy Pay, or we've got Zip Pay, therefore we have a payment plan. We want to make sure that we've got payment plans for a transient type of patient who doesn't actually have a particular history with us, but they may have Easy Pay or Zip Pay to get that tooth extraction done. We want to have payment plans for long-term existing patients who we completely trust. We don't need to go through all the forms and paperwork if they want to just pay off their crown. But we also want to have payment plans for the treatment plans of $10,000, $20,000, $30,000, so they've got options as well. So make sure you've got a full suite of payment plan options. Have it in written brochure form that you can discuss with them and hand to them. Have it as a page on your website. So it's all very obvious. They don't need to ask the question, I can't afford it, what do I do now? Review in-surgery patient engagement process. Going back to that Norbert Aubuchon buying process, the patient engagement process, do role-playing around that. Start getting feedback from each other as team members on how you can better engage and communicate with your patients so they're far more on board and, like you, recognise that their need is strong enough and compelling enough that they want to do something about it. Certainly review your patient handover to reception process. This can be quite enormous too. We'll add this as an additional presentation video because we can talk about this for half an hour because that patient handover, all the information that the dentist has and then is transferred to the reception. So now they're empowered with all the information and the patient is properly supported through the whole process. The patient handover to reception process, if done well, helps that receptionist enormously in terms of if the patient doesn't book in right now, how am I going to communicate with them after the fact? So that's very important. And track your treatment plan acceptance rate. Let's have a look at if we implement this new system, if we implement a role-playing process for patient engagement in the surgery, if we implement a proper patient handover to reception, is it going to be making any difference? And so definitely start printing out, if you don't always already do it, print out as a practitioner, print out your day sheet every day. And then as you move through the day, tick, not recalls, but any other suggested treatment, advised treatment other than recalls, put a tick beside the patient's name. And then through the day or at the end of the day or at the end of the week, go back through all of your ticks and make a circle around the ones that actually booked for their treatment. That will give you your treatment acceptance booking rate, your treatment plan acceptance rate. And then with the added changes that you're making, see if it's making a difference. Keep tracking this. A wonderful thing to do every month, get all the practitioners to bring their figures to the table. So then you as a team can start to identify how can we do things more effectively to help bring everyone's figures up. Maybe one dentist has really strong figures and the others are aspiring to get to strong figures. Have this dentist role play what they do, how they communicate with the patient, how they hand over to reception, how they do all the things, so we can all collectively learn and get better as a practice as well. So, Meanie, we always encourage people to go along to our website. Please, right now is the time to enter in any notes, chat items at all. Feel free to use that QR code to go to our website. But again, all of that's going to be emailed through to you. What we have next week, on Wednesday next week, 1 o'clock Melbourne time, is reactivating your inactive patient base. So the ones that aren't coming for recall, they're not coming for incomplete treatment, they're just not coming back at all. How do we find them? How do we communicate with them? What messages can we deliver to them? How can we make sure that we have as few a number of inactive patients as possible moving forward? And we're not continually adding people to that list. but we want to make sure we're communicating with the ones that are and giving them a good reason to come back in again. There's been a question there. Hello. In regards to the booking links, we use this system, Jennifer Windows, but only for basic appointment time, exam, clean, and emergency, as we need to preset the booking times for the online bookings. How do you suggest we do this for incomplete treatment, as times vary on a treatment plan? We don't want to be in a situation where the patient books in, but we need to change it again because they didn't book in enough time. Does that make sense? That makes wild sense. And the first thing that comes to my mind is have the availability for a 15-minute booking link where that is for existing patients only for discussions about treatment plan, but provide them your email address. Pass on to us your 3 best times for an appointment time, and we'll get back to you first thing in the morning and schedule you in. Whether you can meet any of those booking times or not, it doesn't matter, but at least they'll be expecting your call to confirm an appointment time with them, and they can book straight in. What are your thoughts around that one, Meanie?
Yeah, I agree. And you do have to be careful and have your, processes really nutted out, because again, we don't want people calling people to follow up on incomplete treatment from a year ago when, perhaps their situation has changed and that treatment plan is no longer appropriate. So the 15-minute times for people that need to come in and just review and have a chat about their treatment plan is a really good idea. And then for the other treatments, as Julie suggested, is a really good way of managing that, because, we can't have people just making times here, there and everywhere. It'll be absolute appointment book
Chaos. Well, for all those who attended, please feel free to put in any questions. We're free to hang around for a bit longer. Thank you so much for attending live. It's such a wonderful thing. We've got 20 people attending live. It's such a wonderful thing to present to a group of people. It just seems like to be a natural energy there. And but we will be supplying everybody with the recording link. Thank God we remembered to record it. Otherwise, you and I'll be busy for the next hour, Meanie, re-recording. And also all the downloads. So the 3 incomplete treatment letters, the script for the follow-up to the incomplete treatment letter for the receptionist when they telephone the patient, plus that little standalone script for receptionists as well. Patient handover to reception, that presentation link that goes for about half an hour, and the information around text expander, that also goes for about half an hour as well. And so we'll be supplying all of that. Andrew says, thank you, Julie and Amina. Thank you so much, Andrew. Magnificent. Kelly, some great tips in there. Thanks, ladies. Have a fab afternoon. Thank you, Kelly.
Thank you, Kelly.
Glorious. So whatever we can do in terms of bringing information to you that's really relevant. If there are any webinar topics that you would like us to present, contact us anytime. You can just get all our contact links through the website. And we're more than happy to offer those sort of pieces of information, because it is difficult to get things happening in a dental surgery. Sometimes you just need that 1 or 2 really good ideas, and all of a sudden you can move forward with it. We also encourage you to use this month's download. I'll just remind you by sharing the screen where to find it. Pardon me. Stop this thing here. Go back to here. And if you go to our website under tools and resources, have a look at the downloads, that very top section there, and you will see the mystery shopper questionnaire. Really terrific way of easily and quickly identifying any areas of your practice that you're doing wonderfully. You should make sure that they get done all the time, but also what you could do to improve as well the patient experience. Kathy, thank you. Some great information. Thank you so much. Jane said, thank you, ladies, so much. Have an amazing day. Just what I needed to inspire the staff. How glorious. We all love a bit of inspiration, that's for sure. And sometimes it's the how-to, isn't it, Meanie? It's one thing to be told, go call these patients. You're like, oh, God, I don't know what to do. To actually getting some information and thinking, oh, I think I know how to nut this out now.
Yeah, and I think it is this space something that we're just asked to go and do in a dental practice without any proper training, and it's just so crucial for it to be successful.
It certainly is. It certainly is. So thank you, everybody. We look forward to seeing you next week. Your follow-up email, a lot of you have already booked in for next week's webinar. If you haven't, we encourage you to do so. Register so you get the recording of that as well. And that is all on reactivating your inactive patients. Anything else, Winnie, before we sign off?
Nope.
Wonderful. Well, we look forward to seeing everybody next week, and have a fantastic afternoon. Thanks again.
Have a good afternoon.